For those of you who have printed it, then no taking of pictures nor recording of lectures po. Not allowed po yan. Ma-stop ko ba yan? Okay, course description. This course deals with the concept of disturbances and pre-existing health problems of pregnant women and the pathologic changes during intrapartum and postpartum periods. So dito pala makikita na, oy, mahaba-haba ito na lecture. Yes. And we have the scarcity of time. Alright? Kasi hindi tayo nakapag-lecture nung 23 and 24. Diba? Nawala na tayo ng 6 hours. So we have to compensate or kailangan natin bawiin yun. Pero pag hindi naman, magsabi lang ako sa inyo, not now, magsabi lang ako sa inyo kung kulang talaga yung time. Alright? So, course objectives. At the end of the course, given actual or simulated situations, conditions involving individual client, that is your mother, newborn baby, children, because in NCM 209, we have 3 concepts. You have your MCN, pedia, and your community. Okay, kaya siya kasali dito sa objectives natin. May children, may family. Actually, sa MCN naman natin, guys, in-involve talaga natin yung family when we give health teachings or reminders. Alright? Okay. Dealing with family at risk or with problem, the student, you guys, will be able to utilize the nursing process in the holistic care of client for the promotion and maintenance of health in community and hospital settings. So, hindi pa rin po nawawala yung ating NCP. Alright? So, by now, I would really assume that you know already how to go about your NCP making. No? Diba? Nag-OB ward na ba kayo? OB-GYN exposure?
Wala pa po, ma'am.
ER
Okay.
pa lang po, ma'am.
Ano pa kayo? DR?
ER
ER lang po.
Alright. Sige lang. Okay? Then, next will be assess with client his or health condition and risk factors affecting health. So, dito sa ating NCM 209, we would be able to assess if patient has complications like, for example, hypertension. Alright? And what contributed the hypertension. Alright? We will be able to identify actual or risk nursing diagnosis. Okay? Plan with client appropriate interventions for identified problems. We will include our client as we make our interventions. Okay? Gawa nga tayo ng gawa ng interventions. Yung pala, hindi kaya ng patient natin. So, we rather involve the client. Alright? Implement with client appropriate interventions for identified problems. So, kailangan mo kausapin. There should be a nurse-client interaction, no? Before you can implement your interventions. Alright? Kasi mag-a-ask pa tayo ng permission para mag-cooperate din yung client natin para ma-achieve natin yung goal. Alright? And evaluate with client the progress of their condition and outcomes of care. Alright. So, we will talk about pregnancy. Alright? Ayan si buntis. So, syempre, pag pregnant ang mother, first thing, ginagawa natin is to submit the mother for prenatal care. Kani siya nga picture, kaanak ko na kayo ang mother, di ba? Okay. So, what is the purpose of prenatal care? This is to ensure an uncomplicated pregnancy and the delivery of a live and healthy infant. What if the patient already has a medical case? Like for example, hypertensive na jud siya. So we wanted to give her and ensure her na mag-follow lang siya ng treatment regimen for PIH, then she will have a better or uncomplicated pregnancy, no? At saka hindi siya mapuput at risk together with the baby once she will deliver already. Alright? Kaya ensure tayo ng uncomplicated. Kaya ina-encourage talaga natin ang mother to submit herself for prenatal care. Kasi during prenatal care, nalalaman natin kung merong diferensya yung mother. Kasi SOP po yan. Pag prenatal care, may mga laboratory works na pinapagawa si Doc. Alright? Sige. So, in pregnancy also, there should be balance of forces. Hindi po pwede na uunahin natin si mother for survival, then ang fetus is baba. Dapat pantay po sila nating, kung si mama nanganak, wala dapat complication si mama. Kung, as well as a baby. So, dapat pantay po siya. Balance siya supposedly. Alright? So, we have 5 branches of maternal health. Namely, nutrition, prenatal care, safe delivery, and of course, you have your breastfeeding. Meron pang isa pala guys, family planning. Alright? Sa nutrition kasi guys, we should have a daily reference intake ng pregnant woman na childbearing age na 2,200 calories. Pero pag buntis siya, dadagdagan natin ng additional 300 calories. So magiging 2,500 calories dapat ang matitake ni mother. Kasi nga, di ba dapat proper ang nutrition ni mama so much so she would be able to carry the baby healthy, no? Paano tutubo yung baby natin inside the womb kung ang mother mismo hindi kumakain ng tama? All right? What the mother eats, the baby also take it. Okay? Kasi they are one. Okay? The mother is the one that would let the baby grow inside the womb healthy. If the mother eats healthy, then the baby would become healthy. All right. So we are done already. Not only should we give the mother calories, no, but we also give the mother protein. So ang mother kailangan ng 44 to 50 grams of protein, no, na matitake niya. All right. So the doctors would really, kasi hindi naman natin lahat na kukuha yan sa pagkain, no? Lalo na yung folic acid. So definitely, the doctor would order 4 supplemental vitamins like iron, your folic acid, no? Kasi nga, yung folic acid talaga, guys, is very essential for brain development ng baby. Kasi kung lack ng folic acid, nagkakaroon tayo ng mga neural tube defects or congenital anomaly sa mga baby. So that is how important your folic acid is. So, in prenatal care, okay, can you still remember how many visits per pregnancy ang mother? Okay, so once a month lang po until 28 weeks gestation, then every 2 weeks po from 28 week to 36 weeks. Then every week na po for 36 weeks until delivery. Alright? So yan. Okay, so let's go now to prenatal. Okay, yan ang prenatal care. Wait. Okay, so regular prenatal care is really needed. This would increase the chance of a healthy mother and child after birth. Then early detection din po siya ng congenital and any birth defects. So, the mother would have prenatal immunizations that can prevent mother-to-child transmission and infection. So, di ba, bawal ang mga immunization sa mother? What particular immunization daw be ang pwede natin ibigay sa mother? Okay, may I call on Miss Balon? Jana.
Ma'am, TT vaccine po.
Okay, very good. So we can only give tetanus toxoid vaccination. No other vaccination po ang kailangan ng mother. Alright? Kasi di ba pag buntis ang isang babae or ang mother, no, buntis siya, even the mildest form of medication is not allowed. Ang mga over-the-counter drugs for headache, hindi po siya, bawal po siya. Kung madala lang ni mother ng tulog or rest, yung kanyang headache, that's the only time na hindi, bawal talaga ang mag-take ng any form of medication, no matter how mild the medication is, such as yung ating mga biogesic, mga ganon. It needs some doctor's advice. Okay? Kailangan natin ipaalam po yan sa doctor. kung magte-take ng what you call this man, medication. Kung ang headache talaga very terrible, then the mildest form of analgesics is given to the mother. Alright? So, yan. So, we go now to the DOH standards of prenatal care. Okay? So, we have the weight. Okay, the height, the blood pressure, the FHT, and of course, the fundic height. Yan pa muna yung 5, guys. Okay? Let's go now to the weight of the 2 to 15.9 kilograms. So that would be equivalent to 25 to 35 pounds. Then, if underweight ang mother natin, 0.5 kilogram per week rather than 0.4 kilogram per week for average. Alright? So, kung if multi-pregnancy naman tayo, guys, higher compared to the singleton. So, kung multiple gestation po yung mother natin, 2 po yung dinadala niya. So, kumbaga is higher a bit na lang, no? Pero hindi talaga ita times 2 or else magiging obese si mother. Alright? So, yan. So, pwede natin encourage si mother na at least 1 pound ang gain niya per week. So, that would really mean na nasa range pa siya. Normal range pa siya ng weight gain. Alright? So, ang first trimester natin na weight gain, okay, it should be 1.5 to 3 pounds lang. That would be 3 months. Yan lang talaga ang dapat i-gain niya. 1.5 to 3 pounds. Ang sa second trimester, no, that would be 4 months to 6 months. No? Okay, that would be 10 to 11 pounds. So if you wanted to get it in kilo, divide it by 2.2. All right? Then third trimester, same with your second trimester. So dito guys, sa second and third, dahan-dahan na po ng kain ng marami ang mga buntis dito. It is because it is not only na you that will gain weight, but as well as the baby inside your womb. So you will have the difficulty in giving birth. All right? Sige. Let's go now to the fundic height. As far as you can remember, guys, no? So, ang 5th month of pregnancy, it should be that 20 centimeters from your symphysis pubis. Okay? 20 cm. So, that would be at the level of the umbilicus, right? As far as you can remember, that is the 5th month of pregnancy. 6th month is 21 to 24 centimeters. 7th month, 25 to 28 centimeters. 8th month is 29 to 30 centimeters. And 9 months is 30 to 34 centimeters. Yan dapat ang height ng fundus ni mother. Okay? Alright, so now, sa ating Leopold's maneuver naman, what is letter A? Anybody can answer? No, what is letter A?
Fundal grip, ma'am.
Very good. That is to check for what?
Sa fundus, ma'am.
To check for what? Okay, fundal grip siya. Siyempre, nakasituate yung kamay mo doon sa fundus ng mother. So, in order for you to check for the presentation. Kasi kung hard part siya, hala, ulo ng bata nasa fundus. Supposedly, nandun siya sa baba. So, kung malambot naman siya, aba, dalawa yan. It's either, it is transverse or wet. Okay, buttocks the baby. Okay, second, letter B.
Umbilical grip, ma'am.
Yeah, umbilical grip is to check for
fetal back, where the fetal back is facing up.
Okay, that is one way wherein we can really check kung saan yung fetal back because after Leopold's maneuver, you're going to check for your FHT. So that is the best area wherein you can hear your FHT very clearly. Okay? So, yung position ni baby ngayon. Yon. Then, how about the third one?
Pollex grip, ma'am.
Correct. And that is to check
Pelvic
for
grip.
the...
Engagement po, ma'am.
Engagement.
All right, very good. Engagement. If you can take hold of the head and if you can still move the head, ibig sabihin, floating pa po si baby. But if you cannot move anymore the head, that means na nag-engage na po si baby. All right? Sige. Pero yung letter D na yan, mali po yan, di ba? Dapat you should be facing sa feet ng mother. And that will be your what?
Pelvic grip.
Pelvic grip.
Okay, sige. Very good. Okay, let's go now to this one. TT immunization. All right. The first TT shot will be given when?
Anytime during pregnancy, ma'am.
All right, very good. So, anytime during pregnancy. TT2, 4 weeks after your TT1. And your TT3, 6 months after TT2. And TT4, 1 year after TT3. And TT5 is 1 year also after TT4. Do you think the mother can complete this immunization? What do you think? Mostly, the mother cannot complete the immunization. Kinahuman naman siya panganak, nganong magpa-immunize pa man siya, mauna iyahang nasa utak. Hindi niya alam na pag makumpleto niya ang TT5, she is immunized for life na. Diba? Yan. O, paano mo i-explain ngayon sa mother para maatandaan niya? So, explain mo ngayon sa mother, just like when the mother would opt for a family planning na pills. Okay? Nilalagay yan sa harap kung asa nagapagwapa si mama. Okay? Then, lagyan nyo na kaagad yan ng year. O, kung after a year, kung what month and year, no? Lalagyan nyo yan, then advise nyo ang mother, ma'am, ipilit niyo dito sa mirror kung asa ka nagapagwapa. So much so, you will be reminded na hala, June na di ay ko for TT3. Then the mother would go to her obstetrician. Why is that? Sige ha? TT1, anytime during the pregnancy, what if at the fifth month of pregnancy, dito pa siya, nakapa-inject og TT. Then, mag 6 months siya, mag TT2. Unya, kay manganak naman na siya, usa ang iyang TT3, makalimtanan niya ang TT3. So, mostly, ang mother maka-tetanus toxoid, no guys, no? Hanggang TT2 lang. So, ibig sabihin yan, okay, the mother would repeat again, TT1, when she gets pregnant again. So, in order for the mother not to forget, it is our own initiative, guys, to make a table. And then, let the mother, advise the mother, no, to put it where she can see it always. Okay? Yan. Then, we will go now to the diet ng mother. And the danger signs of pregnancy, breastfeeding, family planning, and postpartum care. Alright, sa diet ng patient, diba? We need, sa nutrition pa lang, kailangan natin ng 2,500 calories na matitake in niya, tapos about 40 kilograms of protein. So, it is up to her already and our own health teaching na share natin sa mother kung what are those foods that is allowed and up to what particular limit. Mga limits lang yan. Okay? So, danger signs of pregnancy. So, can you give at least 5 danger signs of pregnancy? Give me one, Mr. Divino. Uy, nawala si Mr. Divino. Hello? Wala, di na ko nila madungkan. Okay. James. Sige.
Ano ma'am? No regla.
Danger signs
Ay, danger.
of
Sorry.
pregnancy.
Kala ko
Alright, Miss
kala ko
Gabino.
vaginal bleeding po, ma'am.
Okay, very good. Vaginal bleeding. Okay. Anytime during pregnancy, lalo na pag preterm, tapos biglang dinugo, that is already a sign of danger. In danger na yung baby inside the womb. Another one.
Conversion po, ma'am.
Alin?
Conversions po.
Ano daw yun? Hindi ko naintindihan.
Conversion, ma'am.
Conversion?
Convulsion.
Oh, sorry. Seizure, you mean? Convulsion?
Yes po, ma'am.
Yes, that is one of the danger signs. If the mother is experiencing seizure, yes. Okay, Di Kim Cheng.
Fever and chills po, ma'am.
Correct. Fever and chills. That might be an indication that the mother has infection. All right, Dumadanog.
Urinating frequently, ma'am.
Urinating frequently. Nagibusaw si mother. So that is one indication that the mother might be experiencing urinary tract infections. Okay, Miss Balon.
Severe abdominal pain po, ma'am.
Yes. So, severe abdominal pain. All right. So, that would mean siguro na nag-contract na yung uterus ni mother, no? Tumitigas. So, danger na rin yan siya, guys. Kung lalo na pag preterm pa si mama. All right? Sige daw. Meron pa dito. Meron akong gustong marinig na hindi ko naririnig. Vaginal bleeding, yes. Sa chat ito eh. Okay. Okay. So, Miss Petal Corin, ano pa yun?
High blood pressure po, ma'am.
Alin?
High blood pressure po.
Correct. Increase in the blood pressure of the mother. How about you, Miss Amigleo?
Persistent vomiting po.
Yes, persistent vomiting because when you vomit, the pressure is nasa abdomen po, guys. Tumitigas yung abdomen natin. Pag tumitigas yung abdomen ninyo, pwede din yan siya makakause ng uterine contraction. Miss Asturias.
Sudden increase or decrease in fetal movement, ma'am.
Yes, pwede din yan siya. Ay, wala na gud siya nilihok, ma'am. Ganihara. So the mother should consult an obstetrician. All right? If the mother is used to na naga-jumping horse ang baby niya inside the womb, so an indication also na there's something wrong or naga-undergo ata ng respiratory distress yung baby. Okay. What in GDM? No, Miss Balon, kasi sinabi to GDM, no? Gestational diabetes. Okay, even though that your mother is has a medical problem, it doesn't mean na danger sign na yun ng pregnancy. Okay, what do I mean by danger signs of pregnancy? Na nag-i-indicate talaga na nandyan na yung mother, yung manifestations, kumbaga. Like for example, no? Yan, difficulty in breathing. Taas ang kanyang blood pressure. And then there is leaking bag of water, guys. Okay? Leaking ang bag of water. Yan, sudden escape of fluid from the vagina. Lalo na pag hindi pa oras ng kapanganakan ni Mrs. Alright? So, might be, that would be an indication of preterm labor. Okay? So, the mother should be admitted in the hospital to control, no? The leaking bag of water. Kasi ang mga doctor, if they can still control na hindi mag-prosper or mag-progress yung labor ng client, isa-stop talaga nila yan. So in order for the doctor to stop the contraction of the uterus, what would be the classification of the medication that would be given to the patient? Anong medication yon na nakakawala ng uterine contraction? Can you still remember what classification of medication? Na ay Hoy! Ang oxytocin, nakaka-contract yan ng uterus. Papaanakin mo na ang patient niyan. Okay? Yung kanyang kabaliktaran, ano yun? Tawag na classification. So, yung oxytocin mo belongs to oxytocic drugs that is used to contract the uterus. Ang akin tinatanong is to stop the contraction. All right, Mr. Divino. Tocolytic drugs. All right. Tocolytic drugs are usually given to mothers that experiences preterm labor. Sometimes, ini-incorporate talaga yan ng mga doctors doon sa IVF ng client para direct ang effect niya sa mother. No? Or the doctor would want to buy some time na tigulangon pa ang baby inside the womb. Kasi the more mature the baby is, the more ang kanyang survival rate. Alright? Okay. Alright. Bawi. Okay, so ngayon, tatanong ko ngayon sa inyo guys. Kasi I heard na may students na nag-complain, ang mga CIs daw ng DR, iba-iba ang meaning ng breastfeeding. How come? Sino kaya yung mga CI na yun na nabibigay ng iba't ibang meaning ng breastfeeding? Alright. Okay, letter B. Who would answer that one? May I call on Miss Relion? What is B in breastfeeding?
Father pass po, ma'am.
Okay, Mr. Ocampo. What is B in breastfeeding?
Ano,
What is B in breastfeeding?
Akali.
Okay. Ah? Okay, Miss Shansela?
Yes po, ma'am.
Ano ang B?
B ay best for baby and mother po, ma'am.
Okay, best for baby as well as best for mommy. Diba? Ang letter B. How about R? Miss Lamoste?
Reduce the incidence of allergies.
Correct. Reduce the incidence of allergies. How about letter E? Miss Pamelar?
Economical po, ma'am.
Yes, very economical. No need for you to buy breast milk, no? It is readily made. Okay, how about A, Miss Badayos?
Antibodies po, ma'am, to protect baby against infection.
Very good. Antibodies that is perfectly found in the breast milk. What kind of antibody is that? Miss Masicampo.
What antibodies po, yung sa mother, ma'am?
Yes po. Anong klase yon? Your immunoglobulin, what? Immunoglobulin G. All right? That is your IgG. Okay? Next. What is S? Miss Cabrera.
Mr. po, ma'am.
Ay, sorry.
Sterile and pure po, ma'am.
Okay. So there is no need for you to sterilize because whatever comes inside is sterile. And breast milk is sterile. Okay. How about T? Ira, Marie.
Temperature is always ideal po, ma'am.
Correct. Okay, whatever the warmness of the mother would be the warmness of the milk. Okay, so body temperature ni mama, yun din ang temperature ng milk. So very ideal for feeding. And what is letter F? Martinez.
Fresh milk never goes off po, ma'am.
Okay, fresh milk never goes off. Hindi po siya napapanis, guys. No? Kasi andyan lang siya sa loob ni mama. So, walang way na mapanis. Alright, letter E. Mr. Pavillar.
Ma'am, ano po yung letter ulit?
Ang sunod ng letter F, letter E again.
Easy to prepare and to digest po.
Correct. Easy to prepare. So, di na ta kinahanglan mag-sterilize pa, guys. Na it would really take some time. Kunya, pabugnawon o sa butang nga timplahan og gatas, di ba? So, easy to prepare. Mag-breast care lang si mama. After, paslak na si baby, right? Okay. How about the second E? Miss Lemit.
Ano po, ma'am? Eradicates feeding difficulties.
Yes. Hindi lang siya nalalayo talaga, no? Sa E din na first. Ang eradicating feeding difficulties because meron tayong mga positions in breastfeeding, right? So, hindi po mahirap sa mother to go about breastfeeding. Okay, letter D. Miss Magaway. Letter D. How about Miss Domadano? Miss Magaway.
Develop mother and child bonding, ma'am.
Ano yun? Letter D?
Opo. Develops mother and child bonding.
Alright. Sige. Okay. So, I, Miss Domadanog.
Ako pa rin, ma'am.
Ay,
I
ikaw
po,
yung sumagot?
immediately available.
Alright. Immediately available. Anywhere, anytime. Ay, unsa ba di itong boses? Akala ko si Miss Magaway ang sumagot. Okay, letter N. Miss Magaway.
Ano, ma'am? Nutritionally optimal no mixing required.
Okay, so di na kinahanglan nimo i-mix, no? Readily available na siya. And lastly, letter G, Miss Lebrillo.
Yes, ma'am. Ano po, gastroenteritis greatly reduced.
Okay, gastroenteritis reduced. Alright? So, nagtataka talaga ako. Alin doon? Sino kaya yung nagreklamo? At sino kaya yung instructor na nagsasabi na iba yung breastfeeding na mnemonics na meaning? Kaya nagtataka kami lahat. Tapos, nag-meeting kami nito. Nag-meeting kami nito guys, no? And then pareho man kami lahat. Well, past is past na lang. Okay, so before you initiate breastfeeding guys, we must first teach the mother on the proper breast care. Alright? Before and after breastfeeding. So, paano man natin yan isasabi sa mother? Before breastfeeding, kailangan pong mahumugas mo po tayo ng kamay natin. Then, kailangan pong punasan natin yung ating, ano ang pupunasan? The entire
Nipple po, ma'am.
breast?
Nipple areola.
Okay, nipple areola. Grabe pagka-pronounce it, areola. Alright? So, sige. Kailangan talaga nating linisan yan siya, guys. Kasi during the entire pregnancy, guys, hindi natin alam kung nalinisan ba talaga yan ni mother. Bawal po ang sabon sa nipple and areola. Alright? Kasi magda-dry po siya. Makakakos yan siya ng crack ng nipples at saka si Staphylococcus aureus nakangisi na siya musulod dito. So that would cause your infection and mastitis. Kasi sarap na sarap si Staphylococcus aureus guys sa gatas. Alright? Kaya siya yung #1 causative agent of mastitis or your infection of the breast tissue. Alright? So, kailangan po ng proper breast care before and after. Before, I would advise that you tell the mother na if ever meron lang man siyang hot water, warm water lang po. Okay, ang ilalagay niya sa kung walang OS, walang cotton ball, kasi gina-refrain namin ang cotton ball kasi baka may mga fiber maiwan, malunok ni baby yon, kasali. So, ang ginagawa, kung meron silang cloth, na ibabad yun sa warm water, linisan talaga guys. Inner to outer pa rin tayo guys. From the nipple going to the areola. Alright? Kaya mga tagip-tip din ha. Base ko niya ginig breastfeeding ni baby. Ang iyang dark brown nipple nahimo na di ayong pink. Asa man na adto ang tagip-tip karon? Di sa baby. Unya magreklamo pagid ang mama sa nurse. Ma'am nurse, ingon ka, dili kalibangaon akong baby. Ngano man lagi gikalibanga ni. Kay ngano, ang imong tagip-tip nasupsup man sa baby. Naklaro na siya. Oh, ngano man na pink na ng imuhang areola. Ma'am, nga dark brown man na. So tagip-tip di ay ito, nakaon ni baby. Alam niyo anong tagip-tip?
Libag na, ma'am.
Correct,
Bulin.
libag. In vernacular term, libag. Alright? So that is why it is very important. Uy ma'am, ngano naman po tudluan nato after? Kaya pagdede ni baby, lalo na sa mga mother na malakas masyadong mag-produce ng milk, malakas yung pressure ng milk, minsan, umaawas po siya. Alright? Alaga naman, sarado dayo ni mama ang iyahang suot din siyang shirt or bra after breastfeeding without wiping those. O dito na napanos na siya. Ganahan pa ka ang baby mo dede nga panos ng baho sa tutoy. O dili, di ba? Okay. So before and after. And of course, hand washing also is being emphasized to the mother. Before and after food, guys. Alright? Yan. And we would advise the mother also, guys, to wear brassiere. Okay? We have what we call maternity bra. So, if ever the mother is going out, no, we would advise her to wear maternity bra. Rather than exposing the entire breast, only the nipple and areola are exposed during breastfeeding. And also, if kung able gid siya to buy something, we have flannels for breastfeeding. Okay, taguon niya si baby kung mag-breastfeed as well as it would give her privacy also na dili makita iyahang bed. Alright? So, yan. So, breastfeeding na breastfeeding lang yan. Pero marami po tayong pwedeng ma-share sa mother. Kasi baka naman, hindi nila alam, kumbaga. Not all mothers are educated when it comes to breastfeeding, its benefits, and how to go about it. Particularly yung proper latching natin sa mother. No, yung baby, paano yan? Paano mo malaman na properly latch si baby sa breast? So, naka-turn inside out ang kanyang lower lip. Okay, inside out. And the nipple and areola are being sucked by the baby. Dili lang nipple po, guys. Alright, kasali po si areola. Okay, then ang chin ni baby touches the breast ng mama. Okay, then tummy to tummy po sila. And we have also different kinds of position during, I do hope na yung NCM 207 ninyo, napakita naman yung different positions. Sino yung NCM 207 nyo, guys?
Ano gani NCM 207, ma'am?
Yung well clients.
Si Ma'am Shari.
Ma'am Shari pata, ma'am.
Okay, I do hope that Ma'am Shari also have shown you, no, the proper no, ways to breastfeed the proper position ng mother in breastfeeding.
Yes po, ma'am.
Ma'am,
Okay.
ito po yung mga football hold, ma'am.
Yes
And
po.
okay pa.
Crossover hold, no?
Apo.
Cradle hold, na? Yan yun. Okay, I do hope you still have your notes with you. All right? Kasi importante po talaga yan, lalo na sa community, when you have your community, and of course, when you are assigned sa mga lying-ins. No, kasi meron talaga, sa lying-ins talaga, doon talaga maraming prenatal. All right? Then, of course, the 11th DOH standard is your family planning. There should be proper spacing before the next pregnancy occur. All right? At least 2 years lang man po ang ina-advise ng DOH. Kasi yung ating uterus recuperates in 2 years. So, after 2 years, pwede na po tayong magbuntis ulit. Okay? Pero ang nangyayari sa Pilipino kasi, hindi nila naiintindihan na meron palang recuperation ng uterus. So, ang ginagawa yearly, hagdanan may na, ma'am, kay dugul, murarag magkuan, murarag ano lang ba, gamay ray ligas, kumbaga. Pero that is not supposed to be kasi napuput to danger yung mother natin. Kasi yung muscular layer ng ating uterus, hindi pa siya masyadong strong. Alright? So the mother can have a complicated pregnancy na tuloy. No? Yan. Then, ang postpartum care natin, equally important as with the other parts ng ating MCN like antepartum, intrapartum, postpartum. Kaya dito sa postpartum, ay gamay na kaayo nag-asikason sa postpartum. No. Hindi po. Kasi sa postpartum care po, it involves the psychological aspect of the mother, right? Maalala natin na yung mga psychological, psychosocial, yung kanyang taking in, taking hold, letting go. Pag hindi niya na-undergo yung psychological phases ng postpartum, guys, mabuang atong mother. Alright? So because there is a rapid drop of the pregnancy hormones, that would put a toll on the mental health of the mother. Lalo na pag walang support ng Okay, wait lang ha. Saan man yung nagasamok-samok sa akong screen? Alright. So, pag hindi nag-undergo na ang mother ng psychological phases ng postpartum, pwede siyang makaka-experience first muna niyan, postpartum blues, second, postpartum depression, and the last and the worst would be postpartum psychosis. Yan yung mga posibleng mangyari sa mothers natin. Aside from the medical case ng postpartum hemorrhage or bleeding, which is the most common cause of mortality among postpartum clients. No? Pag hindi tayo marunong talaga mag-care sa postpartum mother, ito po yung mga complication na ma-experience niya. And we don't want that to happen. That is why the NCM 207 pa lang, na-introduce naman yung postpartum hemorrhage. So ngayon naman, what will be the stages of postpartum hemorrhage that the mother can undergo postpartumly? Alright? So yan. So in this area, the significant others is really very important. Kasi nga, di ba, kung kulang ka ng knowledge, guys, pagkapanganak ng mother, ang husband magsabi, unsa pa ba arte ni mo diha? Ito pa sa taking in phase pa ito, ha? Unsa may arte ni mo? Nahuman na. Nganong hilak-hilak makadiha, no? Ganyan ang marinig ng wife from the husband. So ikaw ngayon na burakag kapayason, iba yung feeling mo. Hindi mo naiintindihan ang feeling mo at this moment. Kasi you wanted to talk to somebody. Express what you have experienced inside DR and the labor room, na galisod yun ka dito, then nakapanganak ka, and pag abot pag yun, dili pag yun ikaw ang kumustahon, kundi diretso sa baby, a new member of the family, kay cute man. Maski kumusta man lang sa mother, wala. So dito mag-uumpisa yung postpartum blues. Nobody listened to me. Okay? Kasi nga 'di ba sa taking in phase, kailangan salita si mother, what had happened to her inside. Ano yung nararamdaman niya? Salita siya ng salita about herself, ang kanyang body, ang physical looks niya. Hala, no, ang akong Coca-Cola body, maulsa na lang ni. No, very siya, very particular siya sa kanyang physiological looks. Okay? So, kailangan may makausap siya about this one. Okay, pag wala, ayan na, magtampo na yan. Okay? As well as wala na siyang interest to take good care of the baby, and that would be the start of the depressive state ng mother. And if it is left unseen or untreated siya at that particular moment, yung depression niya, supposedly psychologist pa lang yan at an early stage. Alright, kung severe depression na yan, mapupunta na siya sa psychiatrist. Take na siya ng medication, which is iba na, kaya na-distort na ang kanyang mental health. Okay? So, ang sa early depression ng postpartum, okay pa yan siya mag-therapy, guys. Okay? Ang psychologist kasi nag-aano yan sila ng mga therapy to regain ang ng conscious. Ibabalik niya yung mother sa reality. No, socialization, mga ganyan. So, pareho niya na postpartum mom na nag-undergo ng ganyan na pakiramdam, no? Matreat pa po yan siya ng mga therapy. Pero pag nagpunta na yan sa severe depression, kaya wa jud mo gipansin, may balaan lang na nimo, iitsa sa imuha ang bata daw bola. So, that would mean na ang tingin ng mother sa kanyang baby is a toy. Okay? So, distorted na talaga ang utak niya. Kailangan niya ng hospitalization and medication. Okay? At ipagdasal sana ng significant other na maulian pa ng mother. Okay? So, hindi po talaga pinababayaan, guys, ang mga postpartum patients. Alright? Kailangan talaga nila yan ng makakausap. Okay. So, alas 7 na. Alright. So, okay. Alright. Bidawbi, tanaw na ako. Mugawas ba akong nawong? O distorted lang gyapon? Hala, okay na. Okay. Okay. So, sige. I would start tomorrow na lang for the high risk, ma'am. Okay? Kaya ako may na ay fault, guys. So, dili lang ko magsamok-samok sa inyo sa karon. Ugma na. Ugma na ko. At least one lang makahanda ta. Kay kung ako idiretso ni karon o extend, basi ko niyang makuan mo, malain mo na ako, no? Kay ako rabay late. Pila ka oras ba ako late, guys? Ugma, kay sa Perez naman ko, guys. Ulakaw ko dito alas 2. Siya raw, di ko kaabot alas 4 dire sa kuano, dire sa balay para mag-lecture. Di po. Nahadlok si kuan, Mr. Casal. Wa daw siya ka-appeal sa picture. Okay. So, unsang oras na? 7 o'clock, I will take a picture. Siya, rogyo, di mong sigo tanan, naada tanan, no? Pila ni kabuk, sobra na gani, 43 na, ingon, 42. Ay, ako di ay itong ika-43. Buangi, oy. Okay, sige, ready? Okay. O, tanaw, Mr. Ocampo, si kagdula di ba? O, tanawar ko na. Okay, ready? 1, 2, smile. Okay, next. Next slide. Continue smiling. Okay, 1, 2, smile. Okay. Okay, guys, thank you. Okay, so Mr. Romero, where are you? Okay, so please lead us in prayer, dong.
Okay, let us pray, guys. Dear Heavenly Father, thank you for this wonderful evening, Lord. Thank you for this opportunity to learn new things, Lord, and to recall what we have learned in this word. Thank you that you are with us, Lord. Continue to guide us. This week. And bless the food that we are going to be partaking later on. Here's all we ask in Jesus' name, amen.
Amen. Pakita pa ginani mo ng tao sa imong likod ba? Maot kayo. Alright. Sige, guys. Happy eating, guys. Alright. Sige, bye.
Bye,
Thank you,
ma'am.
Hi,
ma'am.
ma'am.
Thank you, ma'am.
Thank you.